Hi there, welcome to Improve Your Practice. This is Maya, and Maya's inviting you to tell us a little bit about your background and your current role at this community mental health service.
Sure, okay, so my name is Maya. I recently come from America. I am currently working as a therapeutic group coordinator here at Southwest Healthcare.
Yep.
And I have a background of running lots of different groups with drug and alcohol, mental health, and also sort of adjudicated youth.
Okay.
So that's
How long have you been working in mental health specifically?
about 15 years.
Right. So we might say you're experienced.
I've had some experience, yes.
So what's the range of your role at Southwest Healthcare?
Well, basically, my role is to support sort of clinical groups, but also try to get more non-clinical groups running, and potentially with letting consumers and carers sort of run their own groups eventually.
Okay.
But just really supporting that whole sort of connections and
So part of your role is encouraging people that attend groups as participants to move into a facilitating
potentially,
role.
If they feel like it's something that they want to do, and
that's fitting nicely into a recovery focus.
Yeah, building community, I would say, is another.
Okay. And what sort of groups have you been involved in?
Well, I facilitated lots and co-facilitated lots of sort of therapeutic groups with ACT and mindfulness.
So that's acceptance and commitment therapy.
Yes,
Yeah.
Thank you.
Yeah.
And but I've also done lots of sort of experiential education types of groups.
Yeah.
So people learn by doing. So it's lots of rather than listening about lectures, they're actually doing things, problem solving, working as a team, leadership skills, that kind of stuff.
Okay. And I think you've done quite a bit of exercise based.
Done lots of exercise, yes, that's right. And activities with as far as music, and definitely exercise, and even just sort of arts stuff.
Okay. Oh, well, the reception to your approach within the organisation, how's that? Because I know that you actually work not just centrally here in Warrnambool, but you actually are quite connected to our outlying regional offices. So you've had, it seems to me, looking from outside, that you've had pretty good support to take the group approach into those regional areas.
Yeah, I think there's the ideas there, and I think also due to the aspect of running sort of consumer-based groups, it doesn't require lots of staff, and so with people being understaffed or anything, it just adds to the the service's ability to give people more opportunities, different types of of recovery. So it's not just one-to-one. It's not just they learn from each other.
Yeah, and I was leading into a question which you've partially answered. What do you see are perhaps the differences between working one-to-one and as opposed to the group, and perhaps the benefits of group interaction?
Well, I think that for one, it's very it's an efficient way of getting some information out, especially if it's a informative type of group.
Yeah, like you're saying, with a clinical focus, you can deliver sound information to a group.
Yes, and the other thing about the group work that you can't do with one-to-one is peers hold each other accountable. They're another sort of natural support system. So all those kinds of things, that elements that are part of a good sort of recovery happen in a group.
Okay. Well, I have, as I warned you earlier, a trick question, or one that you're not aware of, but I'm going to ask you what your impression is, your immediate impressions of the term therapeutic relationship. So, your response to that?
Oh, I think it's absolutely essential. If you don't have a therapeutic relationship, you're not going to, build trust. People aren't going to be able to, they put their lives in your hands in some ways, and so if you don't have that relationship, they're not going to, take that chance to try something different.
So do you think it's like professionally constructed, the therapeutic relationship. It's a decision we make as a clinician to enhance it or develop it with people we're working with.
Oh, I definitely think it is a choice. I think I guess the different waves of therapy, you know, I think that it's been proven, you know, for quite some time that relationship is essential. It doesn't matter what therapy you're giving or what you're doing, it's that therapeutic relationship that you have to establish first.
And pleasingly, that supports the research I've done for Improve Your Practice. So I'd like to thank you for being part of the interview today, and it's been most informative.
Thanks for having me.
Thank you.
Thank you.